Imagine your loved one is in the hospital suffering from any of these symptoms: severe pain, chronic pain, nausea, constipation, loss of appetite, muscle spasms, etc. These symptoms arise from diagnoses such as AIDS, rheumatoid arthritis, cancer, glaucoma, spinal injury, fibromyalgia, etc. Marijuana should be legalized for medical use on a federal level in order to make it equally accessible for every patient who is qualified to use it. The main points I'm going to talk about are why there is a need for medical marijuana to be legalized federally, how this plan is going to be enacted, and why this plan is going to work. All Americans need to have equal access to medical marijuana. Traditional pharmaceuticals can cause many undesirable side effects. Many prescription medications do not even relieve the symptoms. For instance, according to a news source named Daily Progress, one patient named Irv Rosenfeld used to take multiple daily doses of strong pain meds. Now he is just using one medication, marijuana, and he is feeling better than ever. There are obviously more people in the United States in need of medical marijuana than just those who live in the 14 states where medical marijuana is legal. According to the Oregon Medical Marijuana Program, residents who are legally prescribed marijuana are still at risk to be prosecuted federally, so there had to be a memorandum enacted so they wouldn't be prosecuted if they were to be caught in possession or using marijuana, even though they are legal to use it. The plan is to make medical marijuana legalized on a federal scale. What works on a small scale, meaning state by state, can also work on a large scale because the process is essentially the same, just on a bigger scale. For instance, Michigan Medical Marijuana Program has a system that can work on a large scale. Patients apply to receive medical marijuana, and if approved, get a medical marijuana registration card so they can differentiate that they are legal. If medical marijuana would be federally legalized, then the state and federal laws wouldn't oppose each other. For example, according to Parloff last year, DEA agents raided 14 dispensaries and arrested 30 people in California for medical marijuana use and possession. How the legalization of medical marijuana on a federal scale is the best solution. The plan works because there is not going to be a migration of people to only states where medical marijuana is legalized. People will have equal access to medical marijuana when their current medications do not meet their needs. It would work because state and federal resources would be combined together to enforce the law more efficiently. Legalization of medical marijuana, according to Parloff, would reduce national healthcare costs because it would reduce the use of these expensive pharmaceuticals. There would be no state and federal opposition in regards to law enforcement if it was legalized on a federal scale. There would be a reduced healthcare cost burden because it would provide an opportunity, an alternative to pharmaceuticals. It would allow residents to continue to live in their own state. To emphasize, I believe that every American who is eligible should have access to medical marijuana, not just those who live in the states where it is legal. We either know someone or a family member who suffers from these medical conditions, which could be relieved only by medical marijuana. We want our loved ones to have the best quality of life. Every person has the right to medical marijuana if they are qualified and meet the guidelines.